to our YouTube channel. We are at the beautiful Gulyas Chiropractic Center right here in Clinton Township, Michigan. I am here with Dr. Gulyas today, and we are going to be telling you a little bit about himself, his profession, his office, and what really sets him apart and makes him unique. So welcome to the channel. If you're new, make sure to hit that subscribe button down below. Give it a like. This is our first video, so give us some love. We'll be coming out with some more videos soon, kind of going over a little bit more detail of what we talked today, but so far we're just going to introduce Dr. Gulyas here. So, Dr. Gulyas, how are you doing today?
Well, Paige, it's nice seeing you, and Olivia, of course, who is the producer of this. But
She
yeah,
is, yes.
Very well. Thanks for inviting me on.
So, how long have you been in practice?
I graduated December of '83, started in January of '84. Really wasn't an internship. It was actually a little above that, but I wanted to come back to Michigan. You know, I went to school out of state, and but I always wanted to come back home. My family was here, and but I don't consider my practice really starting until about it was February of '87 is where I opened here.
Okay, so we're here in Clinton Township. Now, what made you choose this location is this your first location? Is this where you started, or?
I did an internship, what would be considered an associateship, actually. I'm from St. Clair Shores, so this is actually in the area for me. But I chose this location because I was a bodybuilder back in the day, and there were a lot of gyms different than now. They were bodybuilding gyms more than fitness places. But so I chose here just because of the location. And so I've been here 33 and a half years.
Okay. So you started off your business with, it sounds like, a lot of athletes. So can you expand a little bit more on that, some of your expertise in the athletic field and how you got your start there?
Yeah, I actually went back. I was already in practice here for a couple of years, and I became a sports specialist. In chiropractic, we have specialists as well. They're just not as plentiful. We have orthopedists, you have radiologists, I'm a sports. And the reason I did that is I started seeing a tendency of a lot of athletes. And I wanted the athletes to feel comfortable coming to me because the degree would make them feel comfortable.
Sure.
And that's how I became a sports guy because that's where that's why I saw the people coming. But back then, most of the athletes I saw were weightlifters, and that kind of mushroomed into meeting this person over here, and I've done quite a few pro teams, but it all started with weightlifting.
So I know that actually, this may surprise some of you, but a lot of doctors actually in the medical field, they actually refer patients to you, and I know that's kind of an unheard thing in the chiropractic industry. It doesn't happen a lot. Can you expand upon that? Tell us maybe why and what type of issues you're seeing the referrals come from.
Headaches is one of the key things I see. Basically, a lot of muscle stuff. That's kind of, shoulders become my favorite. There's a thing I do on backs, they want to publish me. But it means a lot more if you work together than apart. And I think that's what I've noticed over the years. You go back 30 some years ago, and I never thought ever that I would ever have a referral. Nothing against me, it's just the professions were at odds so much. Philosophically, I think there's a lot of misunderstanding of what chiropractic is. I do chiropractic, but I've really spun off into ways of doing it my own way, kind of thing. Probably about half my practice comes from medical doctors or osteopaths, which I didn't think ever could happen.
You see a lot of patients coming in and out of your doors every day. You do this for a living. What are probably the three most common issues you see with your patients?
Absolutely. The most common thing I see is between the shoulder tightness into the neck. Absolutely. A new page would be between the shoulder blades, these areas. Absolutely the most common thing I see. Virtually, probably almost everybody I see has that. Not necessarily that's why they're here. Obviously, it's not the only thing I see, but pretty much at some point they're going to have symptoms relating to that. Sure. And it's I don't know if there's even a diagnosis of technology, meaning an MRI or anything that's going to pick up the muscle issues. It's kind of a palpation thing. But absolutely that's number one as far as what I see. Number two and this is gaining a lot of numbers here, especially in the last couple of years, is a lot of hip things. I'm starting to see a lot more hip things. We talk about this. I mean, there was a time I probably would only see certain ways of hips 3 or 4 a year. I'm probably averaging 5, 6, 7 a day now.
Oh.
And people will ask, well, is it because we're getting older? And I said, I don't think 60-year-olds or 70-year-olds today are much different than 70-year-olds then. But I understand it more now.
Sure.
I kind of know where to go earlier in the process. Number 3 would probably be headaches. And it's one of the biggest referrals I get here. Probably the biggest referral I get from specialists is headaches. I just found a way of doing this technique that I just kind of developed here.
So you touched a little bit on working with muscles. So muscles is a little bit unique, I would say. Could you maybe tell us a few things that you see on a day-to-day basis, maybe your niche market, that has to do with, muscles and helping out people?
We talked about the posture issues that your generation is having. If you want to turn around, I'll show you the most common thing I see. It's issues here and here. And when you get a new patient that will call and say, my shoulders, I heard you're good with shoulders. Well, to me, shoulders is still shoulders, which is the most common thing a weightlifter coming with shoulders. But a lot of times when they say their shoulders, the patients are actually meaning this. It absolutely is the most common thing I see. There are things that are creeping up in numbers to that. Whether God has a different plan, I don't see anything overtaking that. And I'm starting to see it much younger now. I've been doing that my whole career kind of changed on that area. And now I'm starting to see, I've actually seen patients in their teens now coming in with that. And so every parent, that brings their child to me, or in your case, mid-20s or something, and we're talking, and I said, I just didn't really see this 30 years ago. I'm kind of the guy, a lot of doctors use for this in patients, because, it's what I do is unique. But I didn't really see you back then. And pretty much every parent will say, it's got to be that phone, and they're very, it used to be the computer first, but it's got to be that phone. And, I don't know for sure if that's it, but it's got to be something, because when a generation changes like that, and the big thing different now than then is technology, and technology ain't changing. Well, it's not going away.
Right.
Maybe it needs to change, or how we do it. And there are some things you can do to try to make that posture less aggravating, but it's still an issue. If you can't change this kind of thing, you have to change your body to fit that. Sure. It's the only choice you got. So unfortunately, Paige, when you're 26 and I'm going to be 61, when you're my age, I wasn't like that.
Right.
So what are you going to be like at 61? I don't know. I'm not going to be around. But it's got to be addressed early.
Right.
Because you're a professional young lady. You're going to stay in that position professionally, and your sister's going to be the same way, probably for the rest of your life.
Sure.
And unfortunately, there's a lot of stuff that probably could be done differently, or in addition to what's done currently. You have to change the body to fit the behavior. There's no way around it.
We definitely should have a video upon that topic. I feel like a lot of people could learn a lot from that, and probably a lot of you experience it. You can go down that Netflix wormhole where you watch one episode and it turns into a whole night of watching TV very quickly. A lot of people can relate to that, especially with the quarantine that we were just in. So if you wouldn't mind giving us how those out there can reach out to you if they would like to contact you, ask you questions.
Yeah, my phone number is 586-791-4880.
So we're definitely going to touch upon that topic in a future video. So definitely leave your comments below. Thank you, Dr. Gulyas, so much for taking time out of your day. Appreciate it. We're going to be having a lot more videos coming up, kind of delving a little deeper, getting a little more specific into some of the issues we touched on. So let us know if you have any questions, have any concerns, or want anything to ask to the doctor. Leave them in the comments down below. We'll definitely be checking those out, and we will be coming out with more videos very soon. So thank you so much again, and we'll see you all very soon. Thank you.